Good afternoon, everyone. Thank you so much for coming. We are really excited to be celebrating a couple of different milestones here today and are joined with some of our really important partners here at Lumen and across the city. You will hear again from Renee Rassilyer-Bomers from Swedish, and Swedish and First and Goal have just been remarkable partners here at Lumen Field. You also hear from our chief of the fire chief, Chief Scoggins, who will talk to you about all the amazing work that they've been doing throughout this pandemic in both testing and vaccinations. From FAS Chief Calvin Goings, who has, in his spare time, stood up one of the most remarkable vaccination sites working across city departments. And then we'll hear from Ollie Garrett, who is really one of our most, she wears so many hats in our community. You may know her with Tabor 100, but she's also a business owner herself, involved in the community, and has been a vital part of one of the people we've turned to make sure that we can have equitable distribution of vaccinations. Working with our partners at First and Goal and setting up the site, we were hoping that we could get more vaccinations and enough to really make sure that Seattle was one of the first cities in America to vaccinate sufficient number of people to reach that community immunity threshold. And as many of you know, I have been persistent in talking to the White House, talking to the governor, talking to everyone we could to get more doses for the city of Seattle. Throughout this pandemic, I could not have asked for a better and more important partnership than between us and the governor, but even more remarkably between myself and the county executive and through Seattle King County Public Health. They have been every step of the way standing up to work together to first address this in the earliest stages of the pandemic when we had no federal assistance or playbook, to now through vaccinations. We know that the road to recovery leads through vaccinations. And today we are reaching important milestones. Here at Lumen, we have done over 50,000 vaccinations. Say that again, we've done over 50,000 vaccinations. Next week, we will get 50,000 doses across all of our vaccination sites. And I want to say to anybody, if you are not signed up yet for your vaccination, please sign up. This is your way to help your own health, your family's health, your community's health. Sign up at seattle.gov/vaccinations. If you are 60 or older, you can go to either Rainier Beach or West Seattle with no appointment. Just walk right up, we'll give you your vaccination. And if you get somebody who's 60 or over to those sites, we'll vaccinate you too. We want as many people as possible to sign up through these vaccinations. This has taken an all-out effort by the City of Seattle, King County government, and the Department of Health and public health officials. Just for Lumen alone, we decided that we needed to make sure for an all-city effort, the leadership came out of the mayor's office, but we relied heavily on the people you're going to be hearing from today. Throughout this, though, the most important reason the city of Seattle has the lowest numbers of infections, hospitalizations, and deaths of any city in America is because of the people who live here. The people in this city and this region stepped up and did really hard things. Many lost their jobs or their businesses. They stayed at home, they wear their mask, and we still have to do it. We're not out of the woods yet. But I want to thank the people of this region for looking out for each other and for those they love. And I want to turn it now to one of the extraordinary partners that we have, Executive Constantine.
Well, thank you so much, Mayor Durkan, and thanks to everyone for being here today. It was just a few weeks ago that we stood here launching this site with so much anticipation about the good that we could do for the people. Well, since then, as the mayor said, thousands upon thousands of people have been here, some 50,000 vaccines, doing their part to end the pandemic. And all throughout this year, we've heard, you've heard this from us, we have the capacity. We will get the vaccines out. We just need to get the supplies from the federal level, and we will do everything in our power, city and county, public, private, and nonprofit, working through every provider to get those vaccines into arms across this county. Now, it's really exciting because right now is kind of the moment that we've been anticipating. We're finally seeing an increase in the number of vaccine doses that we're getting from the national level. It is going to bring us closer to having the supply match the demand. But let's be clear, despite the slow buildup, and it has been a slow buildup, we're making enormous progress. I am pleased to let you know that as of yesterday, more than 37% of adults in King County are fully vaccinated. As of yesterday, some 60% of eligible people in King County have received at least their first dose. This site has vaccinated 50,000 people. Across King County, some 1.1 million people have now received at least their first dose of the vaccine. And I want to let you know about another exciting development. I talked about the vaccines increasing, the vaccines coming from the federal government. Next week, we will receive around 200,000 doses across King County. That is more than double what we were getting across the county when this clinic opened. For the first time ever, we are going to be able to supply every single provider that is asking for vaccines, large and small. So we'll be able to bring more vaccines here to Lumen Field and to the other City of Seattle mass vac sites. We'll be able to supply the mass vaccine sites the county has set up in South King County and in East King County. We'll be able to supply small clinics across the county. We'll be able to supply individual providers, trusted partners in communities. Those are the folks, including small pharmacies, who may have the trust to help some people overcome that vaccine hesitancy that you hear about. So this is an exciting moment because we're not only going to be able to begin addressing some of the wait lists that we have here at Lumen Field and elsewhere, but also get vaccines into the hands of providers who may just be the key to getting that hesitant person to agree to get vaccinated. The increased doses mean that King County can really feel confident that we'll be able to get vaccines to everyone in the coming weeks. And we know the path to progress has not been easy. We know the vaccine, too, is a tremendous tool, the most important tool. But there's bad news, too. Our case numbers are rising again. After plateauing for several weeks, cases are creeping up in King County, particularly among younger people. You know that over 96% of people 75 and over have now gone and gotten their shots. But for those 16 to 34, we're seeing more and more infections, and that's for two reasons. One is that these new strains of the virus are more dangerous. And the other is because with all the folks who are getting vaccinated, people are starting to let their guard down a little bit. We can't have that. We have to run the whole race. So encouraging people, first, get your vaccine as soon as you can. And second, step up the efforts to prevent transmission. It's just a little while longer. You've heard us say it a million times. Mask up. Don't go out if you're sick. Don't be cooped up with people who are not part of your household. And see this thing through to the end. Those simple steps, I know you're sick of hearing about them, but those simple steps are the steps we need to keep people from getting sick and hospitalized. We are seeing an increase in infections and an increase in hospitalizations, and this tantalizingly close, being this tantalizingly close to the end of this pandemic, we can't let down our guard and let people get sick. So sign up, get your shot. You might even be able to come here, get your shot, and then make it a doubleheader by taking in a Mariners game right across the street. They've set it up so it's very safe to watch baseball again in person. It's now my pleasure to introduce to you Renee Rassilyer-Bomers, who is the Chief Quality Officer of our strong partner, Swedish Health Services. Renee.
Thank you for having me here today, Mayor Durkan. My name is Renee Rassilyer-Bomers, and I'm the Chief Quality Officer at Swedish Health Services. It is so exciting to be here today with everyone celebrating 50,000 shots in arms. Each milestone that we hit at this mass vaccination site, each shot given is like therapy to all the caregivers and clinical supporters who have been on the front lines throughout this pandemic. It truly is really emotional for our team, and I'm grateful for everybody's support. As we've shared, we're able to vaccinate 22,000 people each day at full capacity, dependent on vaccine. We're thrilled that we'll be able to do some of our biggest vaccination clinics next week with the allotment we have received from the city. On behalf of our entire Swedish team, I want to thank the mayor for her tenacity to getting those city doses so we can get more doses in arms. Now, we recommend that everybody who is eligible, and that's everyone 16 years old and up, to get vaccinated as soon as possible. And over the next few months, we urge everyone to continue wearing a mask, practice physical distancing, and washing hands frequently, following the most updated CDC guidelines. Hundreds of volunteers, both clinical and non-clinical, have contributed to the valuable time and energy thus far in this effort, and numerous Swedish caregivers have also volunteered countless hours of their time. I want to thank everyone for all that they have done to roll up their sleeves and to support vaccine distribution as safely and quickly as possible. Thank you. Now I would like to introduce Chief Scoggins.
Hello, good afternoon, everyone. My name is Harold Scoggins, Fire Chief of the Seattle Fire Department. What a great day it is, what great news it is, getting more doses to really help community reopen and get back to normal. We're excited in the Seattle Fire Department to be able to test our capacity at our vaccination sites. Many of you know at our 4 testing sites, now 2 testing sites, we've tested over 720,000 people since June 5th of 2020. Now, since January 14th, we've tested over 78,000, we vaccinated over 78,000 people in the community with our 4 mobile vaccination teams, with our pop-up sites, and now at our Rainier Beach and West Seattle sites. So that's really exciting for us. Next week, we're going to be able to increase our capacity and go up to 1,500 vaccinations a day at our West Seattle and our Rainier Beach site. We're also excited about the new program that the city has launched. If you're 60 or older and you work or live in Seattle and King County, you can now show up to our Rainier Beach and West Seattle site without an appointment, and we'll take care of you. We'll get you vaccinated. And also our Good Neighbor program. That's another exciting one. You can help your neighbor. If you're 16 or older and you bring someone that's 60 or older to our Rainier Beach or West Seattle vaccination sites, we'll get you vaccinated. So a lot of encouragement going out there. We're really working hard to get the community vaccinated. None of this would be possible without our leadership of our mayor, our partnership with our executive Constantine, Swedish, and all of our other partners in the community. But today is an exciting day here at Lumens, and I'm proud to introduce our next speaker, the Director of Finance and Administrative Services, whose responsibility it was to get this site up and running. And as you look in the backdrop, absolutely amazing. So now I would like to bring up Director Calvin Goins.
Hello, I'm Calvin Goings, Director of Finance and Administrative Services and the Chief Executive Officer here of the Community Vaccination Site at Lumen Field Event Center. Welcome, and thank you for being here today. 50,000 vaccines. That is a huge milestone, and it's just the beginning, Seattle. We couldn't have reached this point without the support of many people here today. First, to our incredible partners, and that starts with you, Mayor Durkan, and the clear direction you provided our team from the very beginning that this site be embedded as its guiding principles, equity and inclusion. And it includes our partners at First and Goal, Swedish, and the amazing partnership with our friends at Seattle Fire Department under the leadership of Chief Scoggins. Thank you. I can't think of a better team to have come together to meet the historic moment that we find ourselves in. Second, I want to thank our incredible volunteers and city staff. These individuals have showed up when it mattered most, and it takes every one of them doing their part, from our greeters and wayfinders to our vaccinators and our 35+ interpreters. I want to especially recognize my colleagues at the Department of Finance and Administrative Services, the Yellow Jackets. They have worked tirelessly to convert this 190,000 square foot facility that's normally used for the boat show and concerts into a site of hope. These dedicated public servants redeployed themselves from accountants, warehousers, fleet managers, and construction specialists into the single largest mobilization of city resources in a generation. And third and finally, this site is called the Community Vaccination Site at Lumen Field. And the word community in the name is deliberate. Because this pandemic has laid bare the historic and systemic inequities with Black, brown, Indigenous, and immigrant communities. We have at the city, and we will continue to embed equity into every part of our vaccination efforts. Anyone who wants a shot can get a shot. That means removing barriers. You'll notice we have lanes reserved for community members with mobility and language access needs. We have on-site interpreters, translated materials, and devices that can interpret in up to 200 languages. And it means building equitable partnerships. We do this in everything we do, from how we sign up our patients, aiming to prioritize appointments for those most vulnerable, to how we recruit our own city staff. And thanks to partners like Tabor 100, we've worked to recruit volunteers that reflect the communities we serve. 50,000 shots in arms. That's a great milestone, but it is just the beginning, Seattle. And now I'd like to introduce the president of Tabor 100 and an amazing partner, Ollie Garrett. Ollie?
Thank you, and thank you, Calvin. I'm Ollie Garrett. I'm here today representing Tabor 100 and Tabor 100 Board. The last time that I was in person with the mayor, county exec, Chief Harrell, was January the 15th, 2020. I know that date well because that was the date that we had the grand opening of the Tabor 100 Economic Development Hub in Tukwila, Washington, which is a hub that was created as a resource center for minority-owned and disadvantaged businesses. Within a month of opening, Washington reported the first death from COVID-19. A month after that, the governor issued his stay-at-home, stay-health order. Tabor 100, just like all of you, and all of the businesses who depended on us had entered into an unknown. We were faced with once-in-a-generation challenge, and we grappled with both a public health crisis and an economy in free fall for many of our small businesses. But the board of Tabor 100 did just what others did. We problem solved. We reinvented. We got resources. We Zoomed. Lord, did we Zoom. And most of all, we found a way to support women and minority-owned businesses and each other. We made sure that all of our small business owners were aware of any of the grants and critical financing that was out and available for them. We put on workshops of helping them get state certified and doing other Zoom resources and technical assistance for them during this process. And following the murder of George Floyd, when our sponsors and partners approached us and said, what can we do in order to do something to help Black-owned businesses sustain, that we can look back on a year from now, 2 years from now, and see where we made a difference. We came together with a response, and I'm so proud to say we kicked off the Black Business Equity Funds. On the day of the conviction of Chauvin, our scores got together and selected the Black businesses that was going to receive those funds. This morning at the Tabor 100 meeting, I was proud to announce that over 25 Black businesses will receive a grant totaling close to $500,000. We also wanted to give back to our community. When Calvin approached me about recruiting members from Tabor to volunteer here at Lumen so that the volunteer base could better reflect the communities being served, we jumped at the chance. I want to thank Calvin and his team at FAS, the mayor, and at Swedish and everyone here for embedding equity in the vaccination rollout. Black and brown communities have been severely, disproportionately impacted by COVID. And there is justified mistrust and hesitant on getting the shots among our community. Now, I myself don't like getting shots, but I got it done. And I know this, we all felt so helpless sometime over the past year to make a real difference and help. And now we have a real chance. Each of us can play a critical and life-saving role by getting vaccine. Whether you do it here or at your doctor's office or at the upcoming pop-up COVID vaccination site at Tabor's Hub, I encourage everyone who's able to do their part. Do it for yourself, do it for your family, your colleagues, your neighbors, and do it for our small business who have struggled so much this past year but remain tall and are here and ready to work and contribute. So just as you at the city cheered me on when we launched our hub that long year and a half ago, I want to do the same here today. Congratulations on the incredible work, and thank you for what you're doing here. And with that, I will hand it back over to the mayor.
Thank you, Ollie. I just want to emphasize how important it has been to have forged these partnerships across governments for everyone in city government to do a job that was different than before the pandemic, but mostly with the community-based organizations. We have relied on them over and over again. Ollie, all that you've done, not just through the pandemic, but before, makes us such a better city, so thank you for all you've done. And we know that equity has to come from intentional action. We are dealing with, and we saw in the streets last summer, the impacts that systemic racism and inequities have had in our city and our nation over generations. And vaccinations were no exception. When we started looking at the number, if all you do is say, let's get shots in arms, they won't be equitably distributed. So we focused at the very beginning to make sure that we could make sure that vaccinations got delivered to the communities that have been hardest hit during COVID. If you look at our communities of color, they were hardest hit by the disease and hardest hit by the economic outcomes. And I'm proud to say that as a result, over 45% of the people that we vaccinated in the City of Seattle program identify as BIPOC. 70% of our fire mobile teams identify as BIPOC. 60% at our vaccination sites in Rainier Beach, and 40% here at Lumen in West Seattle. Those are remarkable numbers, but those still haven't got us to where we need as a parity. So I just want to again urge everybody. We have 50,000 doses to give out this week, and we hope to be getting that level of supply for the weeks coming. If we push hard, we can get to the point where we have enough people vaccinated in our community by the end of May, both doses. If you haven't signed up, please sign up. If you are 16 or older and there's someone, a neighbor or a relative, a parent, a grandparent, a friend that hasn't been vaccinated, get them to the vaccination sites at Rainier Beach or West Seattle. We'll get them vaccinated that same day, and we'll vaccinate you too. So again, I just want to thank everybody. This would not be possible. Joining, when we set out at the beginning of this pandemic, we knew that government had to operate differently, quickly, in ways we've never done before. And so we responded at this unprecedented situation in unprecedented ways. But none of it would have been possible without each of the individuals and businesses of this region stepping up each time we asked them to. So with that, happy to take some questions.
The fact that Johnson & Johnson is now one that you can use, is that affecting at all your ability to reach these numbers?
So the question was, is the fact that Johnson & Johnson is now being reauthorized for use affect our numbers? These numbers are without the Johnson & Johnson. When we were building these numbers, we couldn't assume that we could. So we will now be reincorporating that. We have had more Pfizer and Moderna shots throughout this process, but there's some people for their own reasons or because of their occupations or because of how hard it is to get 2 shots that prefer Johnson & Johnson. So we're hoping to get more doses there and integrate it into our system.
There were already 30,000 doses in the county system. Are you going to immediately start to try to reintegrate those? And how do you try to build the trust again in that Johnson & Johnson shot after all the negative publicity?
It's a great shot. So we will be working with the county. King County Public Health has been using most of those Johnson & Johnson shots for other King County sites, but we have had a collaboration to make sure that we know each of the sites, what we're covering and where, and make sure the public knows. Is in terms of trustworthiness, we have to realize that millions and millions of Johnson & Johnson vaccinations have been given. And the side effects have happened in only a small number of cases, and they're still investigating whether that was because of the shot itself. And they were smart to pause it, but I think the fact that they paused it, investigated, and said it's safe, that people should take confidence in that. We have millions of people who have taken that vaccination without any ill effects, and for them it was easier because it was a one-shot vaccination.
Here when the place first opened, it was about 5,000 vaccines a week, I believe. So to get from that point to where we are now, I just was curious your thought process, seeing the progression of this site.
It's phenomenal. We built this to deliver. And it's kind of like Field of Dreams. If you build it, they will come. But it was harder than that. I mean, I have to credit the governor, the county executive, and myself and our delegation. I have been advocating to anyone who would listen at the federal level. Trying to get us a FEMA mass site, trying to get us more. King County Public Health has been a tremendous partner. They were able to get more doses, and we have just been trying to scale up as quickly as we can. And we hope to be able to sustain this. I mean, if you think about that, 50,000 doses, if we can do that over a period of weeks, we will be in such a better place as a city and a region.
I have a question for the executives. You mentioned that cases are rising at the same time that you're celebrating a milestone in terms of vaccinating people. How do you square those two?
Yep.
Cases rising and thousands who have been vaccinated.
So the question is, how do we reconcile the fact that we're getting so many more people vaccinated and yet cases are rising again? Well, I mentioned the new variants of COVID. The first wave that we experienced all throughout last year spread more slowly than these and seemed to impact people less, particularly younger people, less severely. Also, I do think it is a fact that more people are doing more things now. And when that happens, there's going to be more opportunity for those new variants to spread. It is interesting because it is not sort of the exponential growth in cases that we saw in some of the earlier peaks. But the cases, even with fewer people, with more people being vaccinated, the cases are just creeping up and up and up, and the hospitalizations are creeping up and up and up. It is something that we can control ourselves here if we just follow the basic rules that we've all learned over the course of the last year. And I would just encourage people to really refocus on staying safe. We'll get through this together if we can just all mask up and avoid the last of this pandemic infecting folks who haven't yet gotten their vaccines.
Do we risk having to go back to an earlier phase?
We are at some risk of having to go backwards to an earlier phase. Jeff Duchin, our public health officer, is watching the numbers very closely. The governor's office, along with the State Department of Public Health, will be reassessing our county and other counties the first week of May. And they're going to determine whether the trends are such that we need to go back to phase 2. I'm hopeful that the people will respond, that they'll do the things they need to do to prevent these additional infections, and that we can continue to enjoy kind of the level of activity we've had and enjoy it safely until we get everyone in the community vaccinated.
How likely do you think that the community is going to respond in that way? I mean, hospitalizations, like you mentioned, super close. Cases are over 200 per 100,000. People, I know a lot of people who are just sick of having to wear the masks and doing things like that. So how confident are you that the community is going to respond with just about a week left before the decision to move back in phase?
So the question is, how confident am I that the community will respond? Well, I mean, you would have to be a very special person not to be sick of all this by now, right? I mean, it's been exhausting. But I do think that the people of King County have shown a particular tenacity and a willingness to step up to help their neighbors and their families. The New York Times said just a couple of weeks ago that if the rest of the county had done what we did here in King County, some 300,000 Americans would still be alive today. That is a tribute to the people who are standing here, but it is also a tribute to all the people of King County who are willing to listen to the advice of experts, to wear masks, to stay distant, to not be upset and feel put out by having to suffer these minor inconveniences, but to recognize the gravity of the situation and respond, and they can do it again. I believe that we will succeed in this. I wanted to mention one more thing, which I forgot earlier. This week we launched our at-home or in-home vaccination program. So this is if you're not able to get out and go to a vaccine site because of physical limitations, for example, you can call us and we, in priority order, will get you on a list for folks to come to your house and offer you a vaccine. And the number is 206-477-3977, 206-477-3977, in-home vaccines for those who are unable to get to a vaccination site.
Does the Johnson & Johnson situation make a program like that a lot easier?
So again, the question about Johnson & Johnson, I actually don't know where public health intends to distribute the Johnson & Johnson doses that are available. They've been a tiny proportion of the total doses coming into the county. I do know, I do know that the Johnson & Johnson vaccine was particularly useful for certain populations who are transient. For example, those who are living homeless. It's very difficult to keep track, make sure people get back for their second shot. And those who are detained, who are in detention in the jails. And that we were providing those shots for folks who are in the jails. We stopped, but we'll be able now to proceed and offer those doses to people who are willing to get vaccines in the jails. And it's very helpful. That is a difficult environment in which to prevent the spread of infection. We've been largely successful, unlike most detention systems in the country, but we really need to get people their shots.
Last question.
I'd like to ask Ollie Garrett a question, if I may.
Yes.
Are you still hearing hesitation in the Black community and others that you think needs to be addressed in a way that hasn't been addressed so far?
I feel the message is getting out. I think some people slowed up a little bit when the subject of what was going on with Johnson & Johnson occurred. I think that I hear more from the younger community that's hesitant and trying to wait to see, as they say, you old folks, and now you go, is an arm going to fall off or a leg? And we're trying to help the young people overcome, especially in the African American community, to overcome those things. Tabor also, based on with one of our sponsorships from Lyft, has free ride credits. So we've been offering free ride credits to people that want to go to a vaccination shot and get vaccinated. And we've seen an increase in people reaching out to us when we advertise the free Lyft rides to get to the locations. Yes.
So again, thank you very much. And key takeaways. We're still in a really dangerous place in our community, and I know people are exhausted. We are all so tired of this, but we got to hang in there because we are so close. We got to continue wearing our mask, even if you get vaccinated. When you're out in public, wear your mask. Keep a social distance from people. Don't have those inside, lots of people, no mask on celebrations. If you are between 20 and 30, I challenge you and your friends, get together, get vaccinated together. You're the ones that have been getting sick and driving this. Keep yourself safe. Keep your family safe. Keep your community safe. And if you know someone 60 or older, get them to Rainier Beach or West Seattle. Get them vaccinated that very day, and we'll vaccinate you too. And then, if that's not enough, when you come down to Lumen Field, we will give everyone the opportunity to get a selfie with Tony Fauci. So everyone, please, we're at a great moment in time. We have more to look forward to, but there's still lots of hard work to be done. Thank you very much.